So when it comes to the first question, which is related to the approaches in Japan that could be helpful in Sri Lanka. So with the support of all our group members, we identified that community-based integrated care, as she mentioned previously, it would be supportive to our context. And also the other thing is the diverse approaches, as mentioned, the dementia care. It would also be supportive to the Sri Lankan context. Apart from that, we also identified that insurance care policies will also be supportive to our context. So when it comes to the next question, which is assessing the situation of family caregivers in Sri Lanka, we were able to identify that only a few caregiving and small scale organizations are presenting when it comes to the elderly care. And also currently only females, only currently within the family context there are two females quite job to take care of the elders, which is making diverse vacuums within their female context when they are quitting the jobs to fulfill their job requirements and their academic qualifications, just because they have to take care of their elders and their family members. So for the third question, she will be explaining the third question.
For the third question, actually the problem stems from mass migration in the current scenario if you really take. So based on that, we have to improve strategy for aging people to help with dementia, because most of the population is affected by dementia due to being left alone and depression, loneliness, everything that is stemming from that. The next thing is that we have to improve community-based recreational activities, which is very important and it is very much lacking amongst the elderly, although that they have their personal groups of their batch parties and all that, but nobody really participates. So we have to improve community-based strategical programs to improve recreational activities amongst the elders. Currently, we must improve our group work system, which is essential because the same like people can help each other through their group work to improve this system in Sri Lanka to help help each other, to learn from each other and to improve their lifestyles. Then the presidential election mandate does not speak about social workers or anything to include about elderly care, which is a very big vacuum in the system due to this mass migration, so we must improve on that. And then elderly, lobbying for elderly care has to be also included in it. And equitable care is a very much necessity, as it's spoken by about some of the speakers. In area-wise, it has to be improved. Because some areas there are too much, activities, but whereas in rural areas they are burdened by their sustainable activities and to survival they have to work elderly. So these systems have to be addressed equitably. Then developing recognition and workforce caregivers in Sri Lanka, I think, is a very important thing, because caregivers is very popular, the name caregiving, after COVID-19. Like everybody wants to be a caregiver and just fly off to a country. But if they really improve that in Sri Lanka, based on their salary scales and the recognition for that job and the work for that job, I think that is very essential. And then awareness. We must create an awareness amongst people for this problem, because it is not a small issue, it's a very great issue, and we tend to really, ignore it because we are all busy. But the elderly are suffering inside without speaking about it. So this awareness has to be brought really amongst the migrants abroad, the Sri Lankan migrants abroad. So we have to make that really an essential thing. The next, gazetted policies has to be done, and those policies has to be implemented. Because sadly in 2017, I recall there was a study done in collaboration with the MOH to improve policies in Sri Lanka relating to elderly care, but unfortunately those policies are not implemented. So not only creating policies, but implementing them in Sri Lanka is very essential. And these impacts have to be seen in dimensional wise, like psychological impacts, social networking, meaning that they, close ties with others when they are alone, they are comfortable, they say, no, I'm good as I am, but we shouldn't allow that to happen. And then the coping mechanisms, we have to educate them on, and then the burden. We must do something policy-wise to remove the burden of looking after the children, grandchildren, with these elderly people because they can't handle it. So it has to be addressed. And then the healthcare, when you say healthcare, we have to bring in systems where eyes, because most of them lose their sight, and then hearing, the walking motion, abilities, all these have to be addressed in a systematic way to help them. Thank you very much.